Hello everyone. This is an IVF cycle summary information sheet. This can be presented to the patient as a printout, as a discharge summary after the IVF cycle. So it captures the basic information like the hospital record number, the MRN number, basic details about the patient age and name, and the kind of procedure that they have undergone, basics of the stimulation protocol, and basics of the IVF cycle details like the semen parameter on the day of OPU, and also has information related to a brief information about the embryology. So this is a one-page document, saves you from giving large reports wherein the printout would take up too many pages. So let us see how to fill this quickly. So this is DIRS, or you can rename it to MRN or whatever you wish to. So this number is the unique number given by your hospital. So this sheet is useful for those small clinics, IVF clinics and setup who cannot afford their own HIS system. So this field is the name of the patient. This is the patient age. Then we fill in the patient's husband's name and the husband's age. This is the basic template is for IVF ET self cycle, but you can change it to whatever the procedure was. You have a choice of entering the kind of protocol. These are pre-filled. The drug can be pre-filled. Duration is the duration of the stimulation cycle, for example, say 12 days. This is the total dose of gonadotropin, which you can calculate based on the dosage that you have given. This is the type of the trigger, which can be pre-filled. This is the OPU date. So the OPU date is a date choice picker. You can pick the date. Then this is the semen parameter on the day of OPU. You can just fill in this information. You can write the concentration in million per ml. This is the motility, whatever the motility on that particular day. And the source is again whether it's ejaculate, frozen sample, or a surgical retrieval. Remarks, as in whatever remarks you need to give to this particular semen sample. It could be something like poor morphology, and you can mention the kind of morphology percentage. The method of semen sample preparation, it could be one of these. This is the IVF lab detail wherein you mention the OCCs retrieved, the number of M2, the number of M1, GB, and so on. The method of fertilization by default is ICSI. You can change it to IVF. The embryo culture till day 5 or day 6 depending on your protocol. The total number of embryos formed. And here you can choose the image to be given to the patient. Maybe you can choose the first one as the image of the blastocyst that has been transferred. This can be resized. The second one could be the rest of the embryos which have been frozen. This can be resized too. You can enter the ET date, 28th. If it's a blast transfer, the number of embryos transferred. You can also enter the cryo date, which would be the same date as the ET. You can enter the number of straws, remarks, and the kind of embryos that you froze. You can enter the renewal date for the cryo renewal. That could be next year around the same time. So you could just change that. And this would be the digital signature or a physical signature of your doctor. So this is the embryology sheet, which can be then printed on your letterhead and can be given as a discharge summary to your patients. Thank you.